Salam alaikum, everyone. Thank you so much for connecting and coming out to our today's webinar talking about healthcare solutions, new innovative solutions for healthcare. First, we thank God, and we thank all the good friends and the supporters who came out and helped us, and we pray and we praise the Prophet Muhammad, peace be upon him, peace, sallallahu alaihi wasallam. This is to start off. Before we do that, we will need to pause to for a second to say a prayer. To have mercy, God mercy on our beloved father of Imam Junaid, brother Abdul Majid Sabir. So go ahead. He was a great man. He just came from Umrah and was just an awesome company. And may God bless his soul and have mercy on him. So basically, we to lay down, some background, very important facts to need to give everybody an idea about the importance of the new healthcare solutions. Everything have changed with COVID. Digital healthcare was present before COVID, but obviously have accelerated during the pandemic. Now it is really empowering everyone to go and have the mobile app that will not only get to everyone, regardless of their location or remote location, but they will able to help to ease their search and to give them the healthcare. We know that between the pandemic, the fear about infection, the cost of gas and the time consumed and so on for driving back and forth has put a lot of burden on people pocket and also added costs. And now that comes in with the digital revolution of healthcare. Why? Because it's part of a total culture change that started first with the banking, for instance. Everybody does their banking online. Then it comes the shopping online, and then obviously healthcare is going to be a natural follow. We know that the most important commodity is health, and we know that very well as a consequence of the COVID pandemic, and that puts an opportunity and a challenge also where we go from there as healthcare providers and so on. I'm here addressing mostly the independent healthcare providers that really would like to join in and in a new way to address the issues and also to help make a solution rather than adding to the problem. There's a lot of burnout. There's a lot of fewer and fewer independent providers, but this will give an opportunity not only to um, the physicians, but also physician assistants, nurse practitioners, even the doctors in training, or the residents or fellows, and even those who graduated and have a license to practice, but they have family commitment and they're at home. Moms at home now that they have an opportunity to have their own virtual shop, if you would, and help people and make a living, and also preserving the family present time. So it's a very exciting time. It's a very important to share this new transformation in the way the healthcare is delivered, and then offer a new transformation also into culture of prevention and wellness rather than acute sick care, and then everybody kind of go back to the same issue over and over, and that's why no wonder healthcare is number one cause for bankruptcy, and that is can be changed for the most part, more than 90% or so. So now we're going into a culture of wellness and prevention, and we will address that rather than the urgent care kind of approach that will not get us anywhere. Now the people are more inclined towards to really hone in and listen and be aware of what's going on. Why do we have to address this? Why does it ProntoCare will be a great source of um, to the providers, to the healthcare providers, like I mentioned earlier, or to the consumers. As far as consumers, well, now we got something that we can trust, we can afford, and we have a convenience. We can do it right from our mobile phone or smartphone, anywhere. We don't have to get up and go to drive and go to ER, or even a doctor's, and then have our healthcare needs being met. We could do this, from a comfort of our home. I think you guys can mute whatever's noise,
Brother Richard, can you mute, please?
please. So, ProntoCare takes proactive role in testing all factors for will lead to chronic disease. We know the chronic diseases cost 85% of healthcare needs, and that's leading mostly people to go to bankruptcy. We can educate and advocate for patients, which is badly needed nowadays because a lot of people don't understand, don't know what's going on, and a lot of people are going in so many ways that put them into risk of not only um, not getting the proper health, but also damaging their financial health as well. So delivering the best care in a safe and a trusted way, an easy way, through the mobile app, that will be a dream that finally come true. We also give back to the community, as we have our motto, bringing the heart back in medicine. So that this is a consumer, a dream come true for the convenience and for the trust and for the saving and for the affordability and ease and convenience. For the providers, the ProntoCare is a great tool that will give a special link to basically provide under ProntoCare brand to promote provider practice. So each and everyone can have their own practice, but they will be putting under ProntoCare family that they can open shop, a virtual shop, if you would, and control their time when they're on and they're off, and who to put on the schedule and so on. That will be a platform that they will actually have a exposure to patients, and we encourage all providers who have basically clean record and passionate about the healthcare, and helping people and so on to join in. And the obviously the independent providers will be so attracted to this option. But also people have a part-time commitment to where they're employed, that they can also have this other revenue that will help them to maintain life, take care of family, and basically don't have to deal with the added stress. This Pronto Care will help networking among different providers and self referrals between the different providers of Pronto Care, as we strive to have all specialties, apart from actual trauma, and all the emergency medicine. Everything else should be here because that is 95 to 97% of healthcare needs could be met with the both prevention and education and lifestyle modification and advocacy, all put together for the sake of the patients. The Pronto Care will also strive to have innovative ways to enhance provider productivity. And this is an added benefit to the providers, that they can actually make more for less, and hassle, and prevent burnout, which is affecting most of the healthcare providers across the nation right now. So that will be a remedy and a therapy for the healthcare providers. They can also meet and educate and help to improve outcome for the patient, and they could have an enhanced collaboration that will optimize patient experience and outcome. They will get group discounts, for instance, if they go in together as a Pronto Care family for malpractice insurance and others. They will be, because it's a number game, so the people can join in the family, and then they can benefit from so many great things, and an opportunity to save money and to really impact the lives of their providers with no added stress or added discomfort. I wanted to make this as interactive as possible. I know it's a Sunday afternoon. Some people, the long weekend, they may be out of town or not available, but at least for those who are around, if there is an opportunity to have any questions, I'm just going to add a couple more points that we already know that we're going to change the entire healthcare approach from acute intervention when the acute disease into prevention and wellness and disease prevention, which will, like I said, address the 85% to 90% of the chronic diseases, which is the major portion of healthcare expenditure, and then unfortunately, that's the cause repeated hospitalization and procedures uh, because the root cause analysis of these outcomes have not been addressed by proper prevention and wellness and education. So this also will bring in a notable change in healthcare quality. Will bring in senior advocacy. Will help people save money, prevent them from going to bankruptcy, yeah, give them the best quality of life possible, especially for seniors and extremes of age, and prevent them from going to costly hospitalization that will lead to so many issues that will impair their life. Obviously, everybody's encouraged to share the ProntoCare app and have it downloaded from App Store, and you could do that and share it with others, so that eventually both providers and the consumers, the folks in our community and beyond, can benefit, and all mankind can benefit from these important and immense advantages and benefits to everyone. Again, to the consumer, to the people, as well as to the providers in different levels of care. This is the future. Definitely, digital healthcare is here to stay and to expand and to go everywhere, not only to remote areas, but also to folks who cannot make it, like nursing homes, at senior homes, and so on. There will be, some details. Whoever wants to express interest to join the Pronto Care family, they can go in, and then they will have an algorithm to go through with certain fees, which is very very much reduced compared to other what's offered by other folks out there. We wanted to make it affordable and enjoyable experience also, and then we'll go out and try to get as many consumers as possible that they will love and enjoy the quality of care that's being introduced to them by Pronto Care. I'm gonna basically stop here and entertain any questions you may have for me. You can go ahead, Rashad, if there's any, or Brother Khalid, or Sister Sajida. Anybody have any questions? I believe that would be more beneficial to explore at this point.
Assalamu alaikum, Dr. Adil. I have a question.
Sure, go ahead.
Is this like the direct primary care model?
It is concierge medicine. It is not going to be only direct primary care, but it's going to be all specialties. So if you're going to be in the primary care arena, that will be your shop. But then also, I can do cardiology. Somebody else may do pulmonary. Somebody else may do women's health. And so on and so forth. Someone would do pediatrics. So it's going to be in every specialty except the emergency, because if there's emergency, the first thing we do is just call 911. And
Sure.
people say the emergency because of the liability obviously involved,
Sure.
or that you have to go to the nearest hospital center. You have active chest pain. If somebody can't breathe, that will be difficult to manage through telemedicine. But obviously, everything else short of that, people who get leg swelling, that just you can catch it early and then start adjusting medication, blood pressure, high cholesterol, diabetes, high triglycerides, even arrhythmia, to the point that people could be control the rate and maybe put them on a blood thinner in case of something called atrial fibrillation or others.
Sure.
That will
Sure.
prevent hospitalization and will prevent expensive ER visits, and with the same outcome. And then we're going to try also to address different options for people where you can have the same equivalent medications that will do the same job but maybe at a reduced price. This way people feel like we care about them in not only the medicine but also in the financial stress that that comes with the illness.
Sure. Are you going to be collaborating with local labs and radiology places for like
We're
lower
offering,
prices?
yeah, we're offering everybody, whoever labs we talked to yesterday. Actually, there was a health fair to talk to one of the labs, and then most of the radiology folks, know about ProntoCare. But everybody's welcome to join the ProntoCare, both providers as well as labs, radiology, pharmacies, but also always at reduced cash price. That's the only way that anybody can benefit
For
um,
sure.
for both. The consumer will get a break, and also the pharmacies and radiology and labs will also get the cash injection to keep them alive and keep their doors open. So that's it's a beautiful ecosystem that everybody will benefit and survive the
Yes,
adversity of economic turn down and and so on.
for sure. I've been following healthcare across the nation, before COVID, after COVID. So I think this was long overdue in our area. So I think this was a pretty good idea.
I hope with new blood, new leadership like yourself and others that will come and say, you know what, there's an army out there of doctors in training who have license that they can benefit. They can
Mhm.
become join the ProntoCare family, and we can go out and try to get them business, and
For sure.
then they can have income and moms, like I said, but they're cannot work because they have to take care of their babies and their family. They can do that from home, so that would be a great option for them. Nurse practitioners, physician assistants, doctors in training, residents, fellows, or those who would like to supplement what they have in their independent work, or if they have an opportunity that there's no conflict with, if they're employed providers, that there's no conflict with their employer, that they can actually join this virtual platform and can benefit patients and can benefit in their livelihood as well.
Mhm. As someone who has considered telemedicine, and I do work telemedicine on my current job, then there's always the issue of physical assessment.
Very good, very good. There are some prototypes which I think that hasn't perfected yet, even on large levels, carriers and hospitals and so on, that is still fail and still hasn't perfected and still hasn't been come to the point, and it leads to very sophisticated equipment which are very very expensive. I'm talking about the basic assessment of people, especially if they're in the neighborhood, and especially if they're around it, and then they can actually go in and get examined and at a later point. But at least they will get in the official visits kind of evaluation on who they are, what they do, and maybe that will start the road for them to be on board.
Sounds good. Well, thank you for answering all my questions. I think
Thank you. Thank you.
you're
Definitely have very valuable input in terms of someone who's actually doing it. It's a basically different flavor on the menu for independent providers that they would like to join in and offer solutions for people and still have a very noble way of dignified practice of medicine and helping people and still be able to have independence in the way they do things, and some people would like to do that, some people would
for sure.
actually enjoy, so that's an option for them.
For sure. And then this would provide a very good work-life balance.
Everybody can manage their own shop, their hours of operations, morning, evening, weekends. They turn on their basically shop and make me available. And for us, we're gonna try to reach out to different folks and different people who will benefit from digital healthcare, and then bring them to various providers. So that's a huge undertaking, but we want everyone to feel there's a value in joining ProntoCare, both on the delivery of healthcare and also on the way that they impact their own lives. So it's a win-win for everyone.
Yes. And because this is cash-based, it should not be affected by insurance requirements or when COVID reimbursement is no longer being reimbursed for telemedicine.
You know, that's why I want to make it a very clean operation with
Sure.
no headaches. Because if people don't have cash flow, they're dead. For any
Yes.
business in any situation in any field of service or products, if they don't have that, regardless if they deliver and they don't get paid, then obviously they can't survive for long. So this will be a survival, way. It will be a dignified way of practice medicine. It will be an opportunity for continuing to endure independence and to enjoy the practice of medicine.
Sure. Okay. Thank you very much.
Thank you.
السلام عليكم دكتور عادل.
عليكم السلام ورحمة الله وبركاته.
ما شاء الله جزاك الله خير for this beautiful information. I only have one question. I was asked about it,
Sure.
one of my volunteer, and I just want you to answer it. Is this self-business free app? What is this app? That's what the question. I don't know how to answer it.
Okay, it's basically a network or a platform for healthcare providers to have a home. This home is called ProntoCare and join the family. And then they will basically independently run their own operations when they become, joining the officially the ProntoCare family. They will run their own practice, if you would, but it's going to be a virtual practice. And all different doctors of different subspecialties, they'll be interacting with each other, cross-referring to each other. Suppose, okay, I'm cardiologist, but then I can with someone who has a visual problem or a diminished visual problem. Then when we have an ophthalmologist joining a ProntoCare, then I can refer to ProntoCare ophthalmologist. They can give a great service for a reduced cash price rather than people go in and lose their shirt and lose their house because of all this uncontrollable healthcare cost. And sometimes they pay so much and they don't get anything. And it's a very important to make sure whoever is joining our network is the top line providers. They're compassionate, they care about their patients, and that they're not, it's a super affordable compared to anybody out there, and anybody can do a very simple search on Google or others, and then they will come to the points like this is unheard of, this is unbelievable, but we wanted to prove it in a format that is basically can reach everybody in their home and work, nursing home, anyone who needs healthcare, that this could be accomplished very well through the ProntoCare family, and then prevent them a lot of devastation, both physically and financially. There will be, I mentioned
Thank you.
earlier, yeah, I mentioned earlier some benefits for the providers. They will get referral from each other. They will get, sorts of income that they can rely on as the network grows and reaches out to more consumers. They will have a hassle-free kind of a practice where nobody controls them. They will basically make themselves available, and then we'll provide them with patients once they have fulfilled all the initial criteria and have the initial small fees to get in and to be maintained through a social media platform, as well as website, and as well as connected with basically so people could get to know about them, and then there's a third party that control the connection. But we have Zoom-like platform that will basically facilitate the connection. So we're putting all these moving parts together. Obviously, it took years and a lot of tears, sweat, and blood to come to that point. So anybody who's serious about whether continue to be independent provider for healthcare, that they wanted to survive in the middle of all this ominous and changing rules and so on and so forth, this will be a way to preserve the honor of the practice of medicine, and also the honor of the profession, and help the patients save their money, help them from getting devastated and going to bankruptcy, and give back to the community. So it's a beautiful network all over from A to Z. and then we will have a special kind of introductory rates to encourage providers to come and join the network, and it'll be up to them if they decide to join or not. But for now, as I just mentioned to folks, this will be a download phase where people can just go and tell their friends, go check it out. Go check out the ProntoCare app, download it, share it with your friends, let them download it as well, and then see for yourself, and you can make your own decision if there's something that you like as a consumer, if something that you like to join in as a provider, then we'll take it from that point on. So,
So you want to, Assalamu alaikum.
how are you, Rashad?
God, can you explain the consumer side of that a lot more in detail as to
Sure.
what is that?
Sure. You will have a, when they tell you go to the book and see if your provider is on the book, I want Dr. X or Y, or I want. So this will be a digital format that will have multiple providers in multiple areas. Like when we first did the ProntoCare, the brick and mortar version, we had dentists, we had urologists, we had pathologists, and so on. So this will be the digital format where we have different providers from different specialties joining in. So if you want, for instance, a rheumatologist, somebody comes in, you click, and you scroll through the providers on the list on the app. Oh, I like to have I need a urologist or a rheumatologist, and I'm going to make the appointment. And the appointment is very, very simple. You read their background and so on. You like them and say, okay, I'm going to make an appointment, and then you go through the process. Everything is done, independently, so you can go through, a credit card payment, and you can pick up your own time schedule in the clinic that is made available by the rheumatologist that you picked. And then after that, you will have an appointment with them, and then hopefully you'll have a positive interaction with the provider, that you can say that, what, I want to make sure that I can definitely hook up with this particular provider, and then go from there. Same thing if you want to go to a urologist. Same thing if you want to go through other folks in different specialties. That will be the way to join and a way to be served right then and there. Some of them may have actual local physical facilities that they may be, close to where you live, because that's just not going to be just in Tampa, Florida. It's going to be all over. And it will be a great thing that, for instance, I'm looking for a nephrologist, a kidney doctor. And then we'll see a good kidney doctor joined in, and then we can I'll put them on the list, and you can pick and choose. And then after that, some people may get lucky initially to have a doctor that's physically close to them, or some other folks may or may not have that opportunity, and then they will just continue on to see them online till they can refer them to someone in a network or a colleague or someone they trained with, and then obviously they can put them on the right track, because it really depends who you start with as a provider. Then you're gonna basically have a good outcome or bad outcome depending on their way of handling your care. I've seen it over and over again. Someone can take people to the cleaners, and then they don't get any benefit, and some will with the good providers, they will find the issue, they will take care of it in 90% of cases, and everything will be done in the most economic way, so that they only don't get better, resolve the issue, but also they save a lot of money, so they save a lot of stress. I hope makes sense to you.
So this is for people who do not have health care.
This is cash, payment through the credit card. So there's no insurance involved. There's no third party involved. There's no co-payments. There's no deductible. There's none of this, stuff. It's a beautiful way, like the old-fashioned way. You and a doctor or you and the provider directly. We're a platform that we built here at ProntoCare is just connecting people with each other to deliver the best care.
So this would, so if someone did not have health care, this would be really good for them.
Someone have,
Or if they have health care with high deductibles.
here you go. Here you go. Because you know, that will be a great option for them. Or someone looking for a second opinion, for instance. All those, you know, there are other you know,
Mhm.
special
Ah,
situations where they can be served in for travelers, hotel resorts and spas as they go, and they may need you know, health as well, health issues as well. So it is there for everybody, serving all mankind, depending on the status and depending on the situation. But they know one thing in common, that they will save a lot of money. They will feel good that they have a trusted and caring, compassionate provider along the way, and it's affordable. It's really a win-win for everyone.
yeah. So how do people join?
You don't start with downloading ProntoCare app right now. Go
Mhm.
to App Store and then type ProntoCare, and
Okay.
that will get you started. And then the next step is basically, you know, seeing the providers and looking at the all the information. And then if something out there that matches your need or fits your need, there are issues about wellness and so many other educational things
Mhm.
as well that will help people navigate through. We made also frequently asked questions that people can go and educate. So it's a really an awesome platform for healthcare and wellness that people can check out, encourage to check out and benefit from.
So there are already physicians in the network.
We have a few, but they're, you know,
Okay.
increasing in terms of that.
Okay.
Okay,
And I'm sorry, is there a premium?
there's you know, the ProntoCare app is like how could I say, it's um, based on the consultation or the visits, which is
Oh, okay.
different from the ProntoCare brick and mortar, which they can have like annual enrollment. But
Mhm.
everything is basically right there that you can, you know,
Okay.
based on the age. Okay.
Oh, okay. Thank you.
All right. I think I'm gonna, you know, conclude here. I think you guys been awesome. I appreciate everybody's participation, interaction, questions, and also interest in learning more about it, and also share, you know, that we have, you know, I have uh, basically recording the event, and we'll share it with those who haven't been able to participate today. And I would appreciate very much, um, you know, everybody's input, as they can go to info@prontocare.co, and let us know how
Yeah.
this beneficial for you in terms of today's webinar, and then so we can plan other events as well, in the educational events as well in the future. Okay. Any questions? I think I thank you know, God first and foremost, and thank everyone who participated in this
Wow.
beautiful event. And we will keep posted. Please download ProntoCare and on the app, and share it with others. And with that, I conclude with um, wishing everybody all the best. Enjoy your afternoon, inshallah. Assalamu alaikum, everyone. Peace be upon you.
Walaikum salam.
Take care.